What's up, guys? How we doing, man? I know I need a haircut. I got to get one here soon. All right, we're gonna run through chapter 18 in the AP2. This is a long one here, and this is what we needed to have covered last week, so y'all bear with me. Sorry for the bad hair there. All right, but this is a pretty long one. I'm gonna try to hit the chase of it, hit it pretty hard. All right, so we're looking at arteries and veins, and we're gonna be talking about blood pressures and some of these phenomenon. Like I said, I'm not gonna go crazy on that Diet Coke because we do this. Bear with me, it's gonna be a while. Yeah, we were out internet last week. Some of us had trouble at home. So anyway, so blood vessels, in this chapter is on blood vessels, and we'll have a picture on the midterm for y'all to label some of the arteries and veins. That'll be one of our first pictures we've had, the only picture we've had in AMP2 so far for you to label. Okay, so just FYI, we'll label, I'll show you the pictures here in a minute. We'll have you label our midterm, which is coming up in 2 weeks, I believe. For those of y'all, this is for the spring 2021. This will be recycled to other courses. So your test may not be that week for other semesters, but for spring 2021, that's what you got going on. So blood vessels are going to carry the food to the body, to all the tissues, all the gas, nutrients, and waste exchange, and carry that back to the heart. So the main thing of the blood vessels is transporting all the things to the cells that they need and their waste products and their cellular products sometimes back from the cell to the rest of the body. So we're going to regulate the blood flow of the tissues, control blood pressure, which we'll talk quite a bit in this chapter. And of course, we're going to have a bunch of chemicals being made to help us regulate all this, okay? Now, we've already said this before that there's two circuits. The pulmonary circuit carries the blood to the lungs from the heart and then back to the heart, and systemic circuit carries the blood from the heart to the rest of the body, okay? So arteries are the means that carry that away, and they're going to go to smaller and smaller arteries down to capillary beds, and then little capillary beds lead to little veins, to big veins, all the way to the biggest veins like the vena cava, okay? So we have a closed circulatory system, meaning that our blood is always in a tube. Now we'll see if you take an animal class or take a major biology class that the insects, for example, don't have blood vessels. They have an open blood cavity, so their organs are squirted with blood and it collects at the bottom. And they have some blood vessels that carry back to the heart, but they have an open circulatory system where their organs are just saturated with this fluid with blood, like sprayed with blood, and they get what they need that way. But we don't. We have a closed circulatory system. When you bruise and you see bruising, you have broken your closed circulatory system, and some of that blood is seeped out into your tissue space area, okay, in the interstitial space. So pretty cool in there. So they're going to carry distribute systems of vasal, out. They're going to carry it all the way out, and they're going to get to smaller and smaller as we go. All right, capillaries is going to be a big one. We're going to have a short answer question on the midterm test about the capillary exchange. And it's one of my favorite ones about how we get this exchange of tissues, exchange of nutrients and everything carried in the blood at this capillary exchange. We'll look at that in a minute. So we let gases, nutrients, waste, and other molecules exchange here, super important, and it's the thinnest and the smallest of the vesicles, okay? Veins then are going to carry this back to the heart, drain blood from the capillary beds, return it to the heart, and follow the opposite pattern. So they go from small to bigger to the largest one, the vena cava. Okay, each blood vessel has 3 layers. Let's get the picture of this so we can see that better. I get somewhere, here we go. So we have an inner layer, this tuna intima, is a single layer of simple squamous epithelium that lines all blood vessels, and it's continuous with the ventricles of the heart. Okay, then we have a basal lamella, then we have an endothelium, there's some elastic tissue, then we have this tunica media that is going to be smooth muscle. And this is where the concept of high blood pressure comes from. If your nervous system causes these blood vessels to squeeze down, that raises the blood pressure, like when you're washing your car with running water coming out of a water hose. You hold it up and it ain't going to clean the car, but you put your thumb over it, increase the pressure, and it gets more powerful. That is the concept of high blood pressure. So when our arteries clamp down, then that's going to raise pressure in our organs that can be quite dangerous. And we'll talk more about smooth muscle doing that. Then the outer layer, the tunica externa, is connective tissue, and a third layer that has blood supply to the actual artery itself, okay? And we can go back over there and look at these, but it mentions these very quickly. The endothelium, tunica intima, tunica media, the muscular layer, smooth muscle layer, and this tunica externa with the connective tissues and all this outer covering of the blood vessel. Enough said on that. Here's a cool picture showing it, and actually one of our slides we had in AFE 1. Remember from the tissue test, this is the artery on the left. Notice it has a thicker layer of muscle and elastic fibers in here, and the veins are usually collapsed to the side here. Pretty cool picture. And don't forget, there's a nerve fiber right there. If you remember that from AFE 1. Carrying on. Then we talk about these are the levels of arteries. Then you go from elastic arteries to muscular arteries to arterioles. Aorta is the largest one, and meaning it's an elastic artery because it has a lot of elastic connective tissue in it. And muscular is the intermediate in diameter all the way down to arterioles. I think we have a picture showing that. Where is the blood in your body at one point? This is pretty cool. Most of your blood is in systemic veins right now, 56, 55%. Heart, 6%. And then look, that leaves very little on the arteries, right? That leaves, 31, 39% is in arteries. 5% capillary. So that knocked down another one, 34% there. So most of it's in your veins, and that's a kind of unusual thing most people wouldn't get. Veins have valves in them, and this is to prevent backflow of blood. So there's very little pressure in the veins, but veins have valves to prevent backflow. So here's the picture I was looking at. So here's your elastic artery, muscular artery, arteriole. Look at the diameter, 2.5 to 1 centimeters, 1 to 0.3 millimeters, 0.3 to 10 millimeters, 8 to 100 micrometers. Okay, that's getting on down there, right? And veins, there's a valve in there that can vary in size. Cool table there summarizing that. Arteriosclerosis, really bad one here. Leading cause of death in the developing world. Affects large and medium-sized muscular arteries. Characteristic by formation of this arteriosclerosis plaque. Buildup of lipids, cholesterol, calcium salts, and cellular debris. But look where it's at, within the arterial tunica intima. So this is not in the blood, in the open luminary. It's in between the epithelium and the tissue layers. And then when it erupts, that's when it becomes a problem. Plaque tends to form in regions where blood undergoes sudden changes in velocity and direction of flow, branching points, or where vessels curve. And you get this buildup in here. And of course, when it clogs up completely, then the organ or body part that's receiving the blood on this artery then dies or stops working. Or if it ruptures, you get a blood clot here, then that's a moving aneurysm, right? A moving blood clot. Current evidence indicates that plaques are generated in response to some sort of injury to endothelium by high blood pressure, certain types of cholesterol, infections, toxins, and cigarette smoke, high blood glucose levels, high concentrations of a chemical called homocysteine. Vessel walls become inflamed, which attract phagocytes that attempt to clean up the area, actually result in damaging the blood vessel. Eventually, damaged area turns into a plaque buildup. Plaque is located in tunica indica, but changes also occur in the tunica media, smooth muscle. Cells proliferate and secrete an exterior matrix with protein fibers and ground substance around the plaque. The plaque is exposed to the blood. A clot may form in the vessel and obstruct the blood flow entirely, which leads to a myocardial infarction, a heart attack in the heart, or if it's in the brain, it's a stroke. So stroke is a blood flow problem to the brain. A heart attack is a blood flow problem to the heart. 10% of the world population has arteriosclerosis. True prevalence is difficult to determine because most people don't display symptoms of early stages. So at least 10% seem to have this. It's kind of big. Reducing factors include dietary modifications, stop eating fat, physical activity, increase it, lower the cholesterol, control blood glucose, stop smoking, and keep your blood pressure under control. In severe cases, especially in the heart, you might have to have open heart surgery, have stents put in, or bypass surgery. Here's a cool one here. These are when different blood vessels take over and reconnect when they get clot. And we see arterial and venous angiogenesis is what I call it, but it is blood vessels forming around the clot. But usually it's not sufficient to meet the needs, but sometimes it does. Okay, and that's pretty cool when that happens. And that's kind of cool. Where you may have heard where somebody had a clot and then their heart grew blood vessels around it. That's what that's saying. Okay, then we're going to look at the thermodynamics of blood pressure dynamics and some of the things that affect it. Okay, so blood pressure is the outward force the blood exerts on the walls of the blood vessels, expressed in millimeters of mercury. It varies from systemic to mainly from the systemic to the pulmonary. There's a huge difference, but also in large arteries down to smaller arteries, all the way to veins, it keeps falling. Okay, and check this out. So we normally are going to see that blood flow matches cardiac output of 5 to 6 liters per minute. Okay, what are some things that can affect it? Other factors include the blood volume, resistance, the velocity with which the blood flows into these blood vessels. Okay, and we'll talk about that. It talks about how the blood pressure, and the bigger the diameter, then the pressure, this is going to increase the blood pressure if you lower it into smaller ones here. Okay, so cross-sectional areas increase as arterioles branch into millions of smaller vessels. And we see the dilution of this blood vessel and the speed. Three main factors influence blood pressure. Resistance, that is the pressure that the arteries have, the actual artery structures have down on the blood. Okay, and look at this. Some of these, any factor that hinders blood flow through the vasoconstriction, these could be vessels near the heart, contribute little to overall resistance. Resistance is greater the farther away from the body. Then you could have peripheral resistance, right? And increases blood pressure, also increases. So anytime you get squeezing down, you're going to increase the blood pressure. So resistance to blood flow, cardiac output, that's how much blood the heart pumps, and then the blood volume itself is a factor. Peripheral resistance can include blood vessel radius, the viscosity of the blood, if it's thick, and what I mean by that is if it has high levels of lipids and stuff in it, it can be thicker, okay? And therefore it resists movement through there is easy. Blood vessel length, the farther you got to pump something, the greater the resistance. And of course, cardiac output is the stroke volume times heart rate. So, so stroke volume times heart rate. Okay, and you can see here, final factors that determine overall blood pressure. The volume of the pressure would be water lost by the kidneys, water intake, and then the blood volume to begin with. So for increases in blood volume are offset by the ability of the vessels to stretch. So there's some compliance there. Veins are the most compliant vessels. They can stretch quite a bit. Arteries are already under pressure and they can't move a lot. So here are all the things that can set up, that can lead to controlling blood pressure. Here's our peripheral resistance, which can include vessel radius, blood viscosity, blood vessel length, and obstructions, plaque buildup in those blood vessels. Cardiac output, stroke volume, and heart rate, so the amount it pumps and how many times the heart beats per second per minute. And then blood volume would be water intake and water loss, water gain, water loss. All that leads to things that can determine blood pressure. Okay, I'm not going to play, well, I'll play a little video for you.
Let's review what you've learned about the factors affecting blood pressure. Blood volume affects the fullness of blood vessels and influences cardiac output. Greater blood volumes result in higher blood pressure. Mean arterial pressure is a function of cardiac output and total peripheral resistance. As cardiac output increases, blood pressure will also increase. Changes in total peripheral resistance alter blood pressure by affecting how easily the blood flows. As resistance increases, blood pressure rises. Total peripheral resistance is affected by blood viscosity, vessel length, and vessel diameter. Of these factors, vessel diameter alters resistance the most. Vessel diameter is controlled by sympathetic activity and blood-borne substances. As diameter decreases, resistance and therefore pressure increase. You should now have an understanding of the importance of blood pressure and how blood volume, cardiac output, and total peripheral resistance are the main factors that affect it.
Okay, now check this out. This is a really cool picture here. So when we take blood pressure, we're taking systemic arterial pressure. We're usually doing that in the brachial artery. Okay, and systolic pressure is the pressure, the top number of blood pressure, that's the pressure exerted on the artery when the heart is contracting. Diastolic, which is at rest around 80 millimeters of mercury, so 120 over 80 is normal. The diastolic number is the pressure exerted on the arteries when the heart is not contracting. The difference between these is about 80 millimeters of mercury and is pulse pressure. Okay, and we can measure this by listening to the blood coming back in the arm with the stethoscope and the sphygmomanometer. Okay. All right, so we're going to kind of hold off here. What's up? Just lay it right there, Mike. Thank you, sir.
I'll put the batteries in the drawer.
Okay, you man. Thank you, thank you. All right, so let's move on. We'll get some more of this. I'm just kind of let y'all read over that one on the cardiac blood pressure. It just talks about that, and notice I want to get to this picture showing how it changes. I like this picture. So here is systolic pressure in the lower aorta, and we're looking at a elastic artery probably when we check the brachial artery. And look, as you go to the arterioles, the capillaries, the systemic pressure and the blood pressure plummets. And then you get down to on the venual veins, etc. There is very little pressure in veins. So if you cut an artery, it squirts out. If you cut a vein, it just oozes very little because it should be taking blood away from the body. I like that pressure. So more pressure in the large arteries, lower pressure in the veins. So it declines, dropping to only about 4 millimeters in the vena cava and as low as 0 in the right atrium. Valves, the veins, how does veins then carry blood? They have valves prevent backflow, and as the muscle, as these veins go through skeletal muscle, it squeezes and contracts, pushing the blood the only way it can up the vein. So these valves prevent backflow. A varicose vein, there we go, so it squeezes it back to the heart. A varicose vein, and of course breathing also causes the blood to be pushed back in the vein, so that respiratory pump in there. And varicose veins is a diluted or bulging vein that's hardened, that has got blood stuck in it that's not properly working. So those blue streaks are blood not moving in your leg due to something wrong with that vein. Okay, so varicose veins are clogged up, not properly working veins that have their valves broken many times. Hemorrhoid is a varicose vein of the rectum. So a hemorrhoid is a varicose vein, pain in the butt, right? All right, how do we maintain this blood pressure? Okay, well, this is where it gets crazy. We got nervous system maintaining blood pressure. Both the sympathetic and parasympathetic play a role. Sympathetic axons can cause norepinephrine and epinephrine to be released on cardiac muscle and smooth muscle of the body, increasing blood pressure through intermediate changes, increases heart rate and contraction, increasing cardiac output, and vasoconstrictions of arteries. So epinephrine, norepinephrine is going to squeeze down, vasoconstrict blood vessels. Now it dilates the smooth muscle in the lungs, for that's your epinephrine inhalers, okay? But it is going to increase heart rate. And thus the EpiPen that you give somebody that has anaphylactic shock is going to increase heart rate, okay? Sympathetic nerves increase heart rate by releasing norepinephrine on the heart, and they can cause vasoconstriction by releasing epinephrine on the smooth muscle lining the blood vessels. Axons of the parasympathetic system via vagus nerve release acetylcholine primarily onto the cardiac pacemaker cells of the heart, SA and AV nodes, decreasing blood pressure by slowing heart rate, increasing cardiac output. It mildly decreases contraction of contractibility, decreasing cardiac output, and lower. So it doesn't really have much effect on the constriction of those blood vessels. Most axons of parasympathetic nerve system do not innervate smooth muscle blood vessels. However, increase in parasympathetic activity does allow vasodilation and decrease in peripheral resistance. Okay, that occurs because autonomic center in the brain increase firing of parasympathetic neurons while inhibiting firing of sympathetic neurons. When sympathetic neurons are inhibited, blood vessels dilate, but it doesn't directly affect them. Okay, call her in a minute. Okay. Then we so assure the vagus nerve, slowing down the heart rate and causing that to relax a little bit. Okay. Nothing much here. This is showing how the brain then is controlling blood pressure by doing these things. I think that's self-explanatory. Negative feedback controls all that. Here's another one showing that regulation blood pressure by baroreceptors that then tell the brain to tell the heart to increase rate here to raise blood pressure back up. Here's another situation you've seen where people pass out, and it explains how that can happen. Vasovagal synopsis or whatever, kind of when people get scared and pass out, there is some biology behind that. Chemoreceptors then can detect pH, and they can raise or lower the pH. There's epinephrine again. We have a table showing all this. Yes, so here's just a summary of some of the things. Epinephrine, angiotensin will cause increased peripheral resistance. And it is worth noting here that the cause of most blood pressure is not known. Most common cause, I mean, we know what's causing it, but we don't know why it's happening, is an overproduction of angiotensin 1 from the renin triggering that production of angiotensin 2 in that mechanism to get aldosterone released. And in doing so, that goes and causes high blood pressure. And I actually had that situation. So I'm taking a pill that blocks the receptor for angiotensinogen to prevent it from binding to the smooth muscle. So my blood pressure has gone down dramatically because of that. Renin secretion then can also increase parasympathetic activity, vasodilation there. Thyroid, increase the heart rate, increase, contraction, force of contraction, epinephrine. Neuronally, we know that can affect those. Arterial necrotic factor can decrease heart rate increased parasympathetic can decrease, and our decreased sympathetic will cause it to decrease. There we go. Other ones, angiotensin 2 and aldosterone will increase blood volume, thus raising blood pressure. Thank you, computer. And then the endocrine system, arterial can decrease blood volume, and renin decrease in water retention. All that can lead to that problem. All that can help lower it. Hypertension is prolonged diastolic blood pressure. A systolic lower than 90 millimeters of mercury is hypotension. Hypertension is when it's over 90. But under 90 for the systolic, and lower diastolic than 60 is hypotension, and that's somebody that has extremely low blood pressure versus the more common hypertension. Okay, it just talks about that. Severe hypotension, nothing much here. All right, we're going to go on over to capillaries and tissue perfusion. Okay, and we can take a look here at one of my favorite pictures. Here is a general capillary here, and you can see the capillary here is a real one with the red blood cells squeezing through, just big enough for one red blood cell to squeeze through in single file. And they're going to dump the oxygen into the cells, and carbon dioxide is going to come in. We're going to get the exchange of the nutrients and the electrolytes and all the stuff in the blood, in the plasma of the blood. And that brings me to my capillary exchange question that I do want to know. Okay, big one here. All right, coming up, and we'll lead into it. All right, so how do things going to get in and out of the cell? Well, many of them can go through the gaps in the capillary beds or through the holes in it. Sometimes they have to be transcytosed through, and some things, gases, can diffuse through the cell itself. But if you remember, there are three types. Well, we just covered it. There are three types of capillary beds: continuous capillaries, very tight, out of the skin, nervous tissue, connective tissue, muscular tissue, and it's the least leaky of the three. Then the fenestrated capillary beds of the kidney and the endocrine glands and small intestine are leaky, will allow large volumes of fluid and larger substance across capillary bed to go into the tissues. And then the sinusoidal capillaries are extremely porous, and these make up the matrix of the liver, lymphoid organs, lymph nodes, bone marrow, spleen. And this is the leakiest, allows many large substances to cross the capillary into the tissue area. Okay, now let's go back to that, and she kind of covers those, and you can read on that. Now, what's going on here? We have some little precapillary sphincters that can cut off blood flow. So here it's cutting and making it go into the capillary bed. Now it's closed, and so we have this micro control here that does this automatically, or auto control of this. And here we've got a blood flow problem, so we don't even let it go to the capillary beds, we send it straight through. That's called autoregulation. Okay, then we have this myogenic mechanism, counter changes in blood flow by altering arterial resistance. Velocity of blood flow is relative inverse to resistance. So if resistance increases, velocity decreases, and vice versa. That's just a mechanism controlling that. This infusion, okay? All right, so here we go. So who gets the heart? It's the blood. The heart receives about 5% of total cardiac output through the coronary blood vessels, right? And they got to have their food to work. The brain gets about 15, receives about 15%, although it's only 2% of the body weight. But the brain's got to have all that, and it's really got to have its flow, right? And it gets very messed up if they don't get enough oxygen and nutrients. Okay, and here's muscle cells showing how they transfuse, the arteries go out into that. And we're going to get down now to a capillary bed. And this is going to be our short answer question on our test. How do we change the exchange of water at the capillary bed? And here's a good example showing hydrostatic pressure in that beaker. And as you put holes in it, you lower the hydrostatic pressure. That is the force the fluids exert on the wall of the container. Okay, so by the time we get to a capillary bed out in the regular part of the body, the 120 millimeters of mercury from the systolic high blood pressure, hydrostatic pressure, that is the pressure exerted on the arteries by the heart. By the time it gets down to your leg into a capillary bed, it has fallen from like 120, that's the top number of systolic, to 35 millimeters of mercury. And that pushes the water out on the arterial side of a capillary bed. On the venous side, the hydrostatic pressure is dropped from 35 to 15. So as we go across and dilute it, the tube, the pressure falls. That's just like putting a water hose on the ground. Right by the hose, the pressure is higher. You get 5 foot away, and the pressure is much lower. Now, we also have what's called osmotic pressure, and that's the pressure of dissolved solutes in a solution that pulls water back toward them. And as we talk about in chapter on blood, blood is divided into the cellular, the blood cells, and we'll talk about the 7 blood cells, or seven, 5 white blood cells, platelets, and red blood cells. Platelets not really a cell, so but I count as one of my 7 things you got to know. That is the cellular part. Then the plasma of the blood is the water and all the things dissolved in the plasma. And there are a lot of proteins made by the liver called osmotic plasma proteins, and they give the blood a osmotic pressure that wants to pull water back to it. And when we get to this capillary bed, the presence of all these proteins leads to what we call osmotic pressure pulling water back in. So the components of the blood itself, that plasma protein, creates an osmotic pressure pulling water back in. So if we have 35 millimeter pressure pushing out on the arterial side and 25 osmotic pressure pulling back in, then we would get a net outflow on the artery side, and on the vein side, the osmotic pressure is 25 still, 15 out, so we get a net flow in. Okay. In this case, you got a little bit flowing out and a little bit flowing back in. Now, got a couple other players going on. We have this hydrostatic colloid pressure drawing water in, and so it comes out to be this. It's 22 on the arterial side, so a net outward flow of 13 millimeters of mercury pushing water, and all this stuff dissolved in water. Now, what we're not talking about here, and let's keep this straight, we are not talking about gases. Carbon dioxide, oxygen, that's a whole nother game. That's partial pressure of gases in the water or in the red blood cells. This is only talking about the flow of the water out and all the things dissolved in water, okay? Or shall we say, the plasma component of the blood. So it's going to blow out on the artery side because of that 13 out. But by the time we get to the left, remember the hydrostatic pressure drops from 35 to 15. The osmotic pressure, this colloid osmotic pressure now is 22, so we get a net flow of 7 in. Now, what if you're taking a shower and the water is blowing out at 13, but the drain is only draining at 7? You're going to get a buildup of fluid in here, and that is called edema. And that pressure building up in the interstitial space here, which is the name of the fluid, not in the cytoplasm or artery or vein of a cell. This is the fluid in between the cells. This causes pressure to build up, and that pressure pushes this interstitial fluid into the lymphatic capillary, which have veins, valves, and they work just like veins, pushing blood back toward the heart. And so the lymphatic vessels have a purpose. They carry excess cellular fluid back to the heart. And their transport mechanism is the same as veins in the body, by muscles squeezing and pushing the blood in the vein, and the valves prevent backflow. Here, once this interstitial fluid gets into the lymphatic vessel, it's called lymph, and that lymph gets pushed back to the heart. But what's really cool about this, though, is along this pathway back to the heart, God has made these lymph nodes, which are filters of this lymphatic lymph tissue, and in there your B and T cells eat and kill foreign bacteria and other particles that are in the fluid. Thus, cancer transmits from, let's say this is my liver, and so the liver is leaving, the cancer travels in the lymphatic vessels to lymph nodes first, and that's where we see cancer spreading first, is to the adjacent lymph nodes. So I want you to be able to explain this picture on the midterm test, draw it out, and give me these numbers specifically. You better give me the hydrostatic pressure minus colloid is 13, and then 15 minus 22 is 7, pushing back in. So we get a flushing out, but the drawing back in. Now think about it, that blood comes out over here, gives all the cells out here all the nutrients, hormones, vitamins, and minerals they need. And then it gets sucked back in on the vein side with the waste products from the cell, maybe cellular products, whatever, back into the vein side, but the pull in is not as great as the push out. So it builds up, and that pressure pushes it into the capillary bed. Super important concept. I'll say that 100 times in class probably. There's your explanation of it. Very important to see that. Edema is that buildup of fluid. Okay. And that's my big discussion question. And the last thing we're going to do is quickly, about 2 or 3 minutes, we're going to run through all these pictures and just show you the ones you need to know or test and make a few observations. A couple of cool ones here. This is the artery picture we want you to know here, the major arteries in the body. And then there's a vein one. This is figure 18.15. And then we'll do one on veins in a minute. A couple of things. Here's a cool one here, the circle of Willis. Look at this in the brain. Very cool. But when the blood comes up the carotid arteries on each side of the neck, instead of one supplying blood to one side or the other, the blood to come together, and it has a circle in here that allows the brain to get blood from the left to right carotid artery based on there it is kind of blowed up. This will blow up of that. But see that artery could, if that one side's clogged up, then theoretically you might have damage to one side of the brain if you had a clogged carotid artery. But with this circle of Hillis, all the blood gets sent over, even if you have one of your carotid arteries clogged up, and that's pretty cool. Okay, a couple of other interesting things. Notice that I'm getting there. Almost all of the guts, are going to get their blood, from this right here, from this gastric artery here. But watch this. As blood leaves, we're going to see this in a minute. As blood leaves the stomach, it's going to all be carried to the liver. So look at the stomach and small intestines getting their blood here, and watch the veins in a minute. Here's the mesenteric, large intestine. This is supplying blood. Okay, and we're going to now get to veins here in just a second. I want you to watch the veins pulling back. Okay, there's the arteries, the arm, legs. So different places we can check pulse. Different pulse points we can do it with. What is pulse? Pulse is a way to count the heart rate, because every time the heart beats, there is a wave, a pulse out of the arteries. And so pulse rate equals heart rate. So count the number of pulses in a minute, and you've got the heart rate, the number of times the heart beats in a minute. Okay, now look at the veins, very similar named, and you're going to know this one, 1823. I'll probably pull five or so arteries and 5 or 6 veins for 10 points on the midterm in 2 weeks. I believe that is right. What is today? Yes, and that's about 1, 2, maybe 3 weeks today on the 8th and 10th of March before spring break. But I want you to see the veins here in the gut specifically. We'll come back and talk about this later. Notice that all of the small and large intestine has all of their nutrients coming back this hepatic portal vein, and that is where we carry all of our nutrients out of digestion directly to the liver first, and the liver is going to process poisons and toxins and store energy out of that sugar. So everything absorbed in the gut goes to the liver first via this hepatic portal vein. That's really important. Okay, so super big one there to remember. Okay, there it is. There's a blow up of it. So if you do OD or take some drugs, any drug you ingest in digestion is going to go straight to the liver. And so one of the most deadly things at your house is Tylenol. If you eat a bottle of Tylenol, it will kill the liver. Whatever the level on that bottle says, it says like, based on the size of the pill, but it may say like 250 milligrams, you take 8 of those, then you can only take 8 of them in 24 hours. You can take 8 right now, you just can't take another one until 24 hours later. And so because any more than that will kill the liver. And people, I had a cheerleader several years ago in my class that was I didn't get to know her because she was in my class like 1 or 2 weeks, didn't come back, and died 3 weeks later of Tylenol poisoning. So really bad stuff. Rest of this, we're going to skip. And I think we're good. Talking about the largest blood vessel in the body is that splenic vein, and they use it sometimes to do the heart bypass. They'll cut a little piece of that out, graft that for bypass surgery. All right, and I think we're good to go, guys. All right, we're going to stop that, and I will cover 19 on Wednesday of this week, and then what I don't like, I'll shoot on Thursday or Friday and put it up. So I'll have that up for the end of the week. Y'all have a great day, and I'll see y'all later.